Welcome back to the channel. I'm Dr. Alistair Vance, and it's good to have you here. Today, we're getting straight to the point on a subject that is critically important for men's health and well-being after the age of 60. As we are all living longer, more active lives, it is essential that our strategies for personal wellness evolve with us, ensuring our health span matches our lifespan. We're having a direct, medically grounded conversation about safe self-pleasure. This is about intelligent self-care. A patient, a 72-year-old man I'll call David, came to me demoralized. He could no longer achieve orgasm with his wife, but could on his own, and he couldn't understand why. His solitary method was one of intense force, a habit forged in his youth. Without realizing it, he had trained his own nervous system to fail in a partnered setting. His story is a common one. So today we're providing the updated manual. We will explore 4 of the most common and damaging mistakes men over 60 make in their private moments. By understanding and correcting these, you can protect your body, enhance your pleasure, and foster a healthier relationship with your sexuality for decades to come. Let's begin. The first and most destructive mistake is using aggressive, unrelenting force. It's often called the death grip, and it is a primary cause of self-inflicted sexual dysfunction. This is the habit of using the same ironclad grip and high-velocity motion every time. While a younger body might tolerate this, after 60, this habit becomes a neurological trap. Your nervous system learns from repetition. When you consistently apply an overwhelming level of stimulation, you are conditioning your body. This creates a neurological trap known scientifically as hedonic adaptation, where the brain becomes so accustomed to an intense stimulus that it no longer registers pleasure from lesser, more normal sensations. Essentially, you have artificially raised the bar for what feels good to a level that is unsustainable and unhealthy. This creates a silent crisis of confidence. A man begins to believe he is broken, or that he has lost desire for his partner, when in fact he has simply created an unsustainable stimulation threshold. This vicious cycle of desensitization leads to frustration, delayed ejaculation, and even physical pain. So how do you escape this trap? You must begin a conscious process of resensitization. Here is a practical protocol. First, take a break from any orgasm for about a week. This allows your nervous system to reset. When you resume, commit to breaking the habit. Switch to your non-dominant hand. This is crucial because it disrupts the deep, unconscious neural pathway your brain has relied on for years, forcing you to be mindful and present. Abandon the full fist grip and experiment with using only your fingertips. Explore the entire genital area, the shaft, the perineum, the frenulum, not just the head. Spend most of your time stimulating these other areas. Finally, master your rhythm with the stop-start technique. Bring yourself close to the point of no return, then stop all stimulation. Let the feeling subside. Do this 3 or 4 times before allowing yourself to climax. This is the gold standard for rebuilding nerve sensitivity and giving you profound control. Consider this retraining not just a gift to yourself, but an act of profound generosity to your partner, aimed at making shared pleasure possible again. The second major mistake is what I call the dry run. It is the sin of omission, specifically the omission of lubrication. There is a stubborn belief that you shouldn't need it. This mindset is outdated and actively harmful. Let me be clear. For a man over 60, high-quality lubricant is not a crutch. It is essential safety equipment. As we age, our skin's entire structure changes. Its hydrolipidic film, the natural protective barrier that maintains a specific pH to ward off bacteria, thins. Collagen production dwindles. The result is skin that is thinner, drier, and more fragile. Applying repetitive friction to this delicate skin isn't creating pleasure. It's causing damage. Think of it like trying to sand a delicate piece of antique furniture with coarse, dry sandpaper. You're not polishing it. You're stripping away its protective finish and leaving it vulnerable. This leads to confusing nerve signals of pain, physical chafing, and even micro-tears that can open the door to infection. The solution is simple. Embrace lubrication as a wise upgrade. The small cost of a bottle of quality lubricant is insignificant compared to the cost of physical discomfort and emotional frustration. When choosing a product, stick to lubricants specifically designed for sexual use, either water-based or silicone-based. Avoid hand lotions, soaps, or petroleum jelly. Be generous in your application. You want an effortless liquid glide with no pulling or sticking of the skin. Reapply whenever you feel the need. This simple step is one of the kindest and safest things you can do for yourself. The third mistake is the most subtle, as it is entirely mental. I call it the mindless rush. This is the practice of treating masturbation as a purely mechanical task to be completed as rapidly as possible, often driven by residual guilt or shame. This approach misses the point and robs you of the most profound benefits because it ignores your most powerful sexual organ, your brain. Here's the key science. A healthy erection requires a state of deep relaxation, governed by your parasympathetic or rest and digest nervous system. When you rush, you're operating on a fuel of adrenaline and the stress hormone, cortisol, activating your fight or flight system. This stress response actively constricts blood vessels and works directly against the physical state you are trying to achieve. Crucially, orgasm is the grand finale of a parasympathetic process, but it is often triggered by a final switch to sympathetic activation. If you start and stay in the stressed sympathetic state, you never build the proper foundation. The orchestra never gets to warm up before the crescendo is demanded, resulting in a weak and unsatisfying sound. The antidote is to reframe the act as a practice of mindful pleasure. It's not a chore. It's a time for stress relief and self-connection. First, create a sanctuary. This means more than just locking the door. It means giving yourself mental and emotional permission to have this time, to carve out a moment that is solely for your own well-being. Second, begin with your breath. Take 5 slow, deep breaths to manually shift your nervous system into a state of calm. Third, engage your imagination. Arousal starts in the mind. Allow yourself to access erotic thoughts or memories to send powerful signals to your body. Finally, as you begin, broaden your focus. Feel the sensations of your whole body. When your mind wanders, gently guide it back to the present moment. This transforms a hurried act into a restorative form of meditation. The final mistake occurs after the main event is over. It's the abrupt ending. Most men treat orgasm as the finish line and disconnect immediately. This is like leaving a great movie during the final scene, missing the emotional resolution. It squanders some of the most important physical and psychological benefits. First, let's address simple hygiene. After ejaculating, a gentle rinse with warm water is crucial. It removes residue that can cause irritation and is a fundamental act of self-respect. More importantly, however, is honoring the psychological gift of the aftermath. The period immediately following orgasm is known as the refractory period. Your brain is saturated with oxytocin, the contentment hormone, and prolactin, which induces profound relaxation. This is not a moment of weakness. It is a neurochemical gift. Don't rush away. Stay present for a few minutes. Allow the feelings of peace to wash over you. In our chronically stressed world, this practice is a potent form of self-soothing and neurochemical regulation. It actively counteracts the tension of the day and calms your entire system. Use this quiet moment for a gentle diagnostic self-check-in. Pay attention to specifics. Is the volume less than it used to be? A significant decrease can be linked to prostate issues or low testosterone. Is the color normal, clear, white, or yellowish? Or is there any tinge of pink or brown which would indicate blood and requires a doctor's visit? Do you feel any new curvature or hardened plaque along the shaft when erect? This could be a sign of Peyronie's disease, a treatable condition. This self-check isn't about looking for problems. It's about establishing your personal baseline so you are the first to know when something deviates from it. Replacing the abrupt ending with mindful integration maximizes health benefits and turns every session into an act of self-awareness. So there we have them: the death grip, the dry run, the mindless rush, and the abrupt ending. Each is a mistake of force, rooted in a battle against the natural process of aging. The solution, in every case, is to choose the path of wisdom, the wisdom of gentle touch, of essential safety tools, of mindful presence, and of calm integration. This isn't about chasing who you were at 25. It's about understanding the true masculine strength in your later years. It is not about force, but about wisdom, self-awareness, and profound self-respect. It's about adding not just years to your life, but true quality and vitality to those years. It is about treating yourself with dignity. Thank you for trusting me with your time on this vital topic. This conversation needs to continue, so please share your respectful thoughts below. If you found this guidance valuable, subscribe for more content on aging with strength and vitality. Be well, and most importantly, be kind to yourself.